to your networks and to provide a space for discussion in a supportive environment. So our webinars are recorded and available on the Palliative Hub Professional and shared widely with often large numbers of views over time. The question and answer session today will not be recorded, and if you would like to enable captions, please do so at the bottom of your screen. Please keep yourselves on mute during the presentation and rename yourself so that everyone can see your name. Turn your camera off for the presentation, please, and if you need assistance, we'll help you. There will be a time for questions at the end, but feel free to put any questions into the chat at any point. You can also use the raise hand function to speak during the discussion. So we're joined today by Dr. Geraldine Foley, who's an Associate Professor in the School of Medicine, Trinity College Dublin, and PCRN member. Her research is primarily in the field of life-limiting illness, focused on patient, caregiver, and healthcare professional needs and decision-making in palliative and end-of-life care. She is a recipient of both Health Research Board and Irish Research Council funding, and Geraldine has served as an expert reviewer on multiple large-scale international-based research calls, and she is an editorial board member of BMC Palliative Care. She is currently co-academic course coordinator of the MSc Cancer Survivorship Programme at Trinity College Dublin and is also vice chair of the PCRN Strategic Scientific Committee. So over to you now, Geraldine.
Thanks very much, Stephanie, for the introduction. Hello, everybody. So the presentation this morning is a little bit on article writing, publishing as a palliative care researcher, I suppose with the focus of gaining knowledge and skills for those who are in the early stage of their research careers and in the field of palliative care. So as Stephanie's mentioned, my name is Geraldine Foley and I'm an Associate Professor here in Occupational Therapy in the School of Medicine in Trinity College Dublin. And the focus really of the presentation is the how-to and necessity of publishing as a researcher in palliative care. So I suppose as a general background, the question is, why would we publish? And why is publishing our research, the research that we do, so important? I think in a research context, and certainly in a university context where research happens, it is fundamentally an expected output of research. We know that there are multiple other types of outputs from research in terms of dissemination, and that they have expanded significantly in recent years. But publication remains a primary form of dissemination from research. And in a research context, it is the most, I suppose, prestigious form of dissemination and so forth. It is also fundamentally the responsibility of the researcher and the research team. And I think that is the case for whether your research is funded or unfunded. It is essential for pursuing a research-oriented career. It is an absolute essential activity in academia for those who are pursuing a research-oriented position in a university or a full-time academic position in a university. It also fundamentally, when one publishes, facilitates ongoing co-investigation and collaboration with other researchers. Because whilst there are many other forms of dissemination, in terms of a research profile, there are outputs of publications or key things that determine their perceived level of expertise in their relevant field. And of course, it drives further research and pinpoints the next steps for research in specific topics and field. So even though you may do a great project, a great PhD study, or even a great MSc by research, unless you disseminate your findings and through published articles, it's not really going to get out there in terms of the research community to start to have impact. We talk a lot about impact in research, but the very first step of that is actually to disseminate it in this case, formal publication. And also a thing I feel kind of strongly about also is we spend so much time, obviously, getting needed ethics for our research ethics for projects to pass various, sometimes multiple research ethic approval committees. And in our PILs, where we develop documents that the intended participant is going to read, in the end, there's always sections that the research findings will be disseminated, and that usually includes published articles. So there is an ethical responsibility when something like that is stated in a participant information leaflet that will be adhered to. And I think, and that goes for all research where people are being recruited and reading that in a PIL, and that would be their expectations of what will happen in the in terms of publishing the research findings. So there's also an ethical responsibility to publish also. So very simply, obviously, this is the general research cycle to publish. This is it in a very simple way, I guess, where we have an idea, write research proposals, very, very competitive research environment in Ireland, particularly because it's a small pot that we're all competing against, at whatever level we're at. We apply for funding, we do the research, complete it. And then it's here really where we're going to focus on today, which is around, well, how, expectations around journal selection. What type of journal or journals do you target, and why? Do you target journals that are perceived to be very high impact factor? But we know that impact means more than just impact factor these days. So there's a lot of things to consider in terms of choosing your target audience. And also it depends on your specific topic in your research, what type of journals you will target, be it in specifically in palliative care, or perhaps publishing palliative care research in non-specific palliative care journals. Then there is a process of writing the paper, and this is an academic exercise for PhD students. This is a big part of the learning of a PhD. We're now, I think, really, certainly in health services research, in health sciences, and healthcare research, we're really in a stage where the model is you publish as you go. And that is the case whether your PhD is going to be a PhD by publication or a PhD which is examined in the form of a thesis. It is possible to publish as you go and then build your thesis if it's going to be a thesis by examination. It is fundamentally the same work, but perhaps presented slightly differently. The submission stage in terms of submitting a paper to your journal, and then there's sometimes a sometimes long concluded stage of peer review and publication process, which is a significant learning part of the research publication process also, because when you submit your research to journals, it's peer reviewed by experts in the field. This is done in a voluntary capacity by experts, so it doesn't happen very fast, but with quality journals, it happens very, very thoroughly and very completely. And usually there is a period of revisions for work that needs to be revised, depending on the recommendations of reviewers and or editors of a particular journal, and that is more learning involved in that. So that is in a very simple way, the general cycle in terms of getting published and publishing your research. I think it's important to remember that not all research is funding. Whatever level of research you're doing at the moment, or if you're in the very, very early stages of an early career stage researcher, you will begin to learn very quickly that how difficult it is for PIs, primary investigators, to obtain funding to fund PhD students, be it through various research programs, national, university-based, or international. Research grants, be them small or large, are very, very competitive in Ireland because we're competing towards a relatively small pot. But it's really important to remember that both funded and unfunded research is published. So I think any research we do should be published. So it's not just funded research that gets published. There's an expectation, particularly if it's in a PIL, that the research will be disseminated in a formal method like this, that would be achieved, following the completion of the study. You always source your funding. Your source of funding is always disclosed if you do get funding. And that's the case when all or any part of the research is funded. So sometimes we receive funding to support a degree of the amount of work that goes towards a project. So it's always important at the end of a research paper and you are asked by publishers, obviously, to disclose who funds the research. And sometimes projects can be funded by research grants that a PI has obtained from multiple sources and just combined in terms of funding the research program. There are different types of early career research funding programs. Again, many will be university based. I work in Trinity College Dublin here, and Trinity have in recent years revamped how they fund Trinity Research Doctorate Award scholarships in terms of funding students on a full-time 4-year PhD. But there are also national and international funders that specifically fund programs targeted essentially at PIs some of the time to get grants that will fund PhDs on an overall program theme. Some of these funders are HRB, Research Ireland, Marie Curie, and so forth. So, and this is formal funding and particularly competitive. So I'm just going to focus a little bit. Many of you today may be already very familiar with this. Some of you maybe have a stage where you have already published or are in the process of writing up papers from your studies, or maybe just beginning to contemplate now formulating some research papers, be them systematic reviews or original studies from maybe your PhDs, MSc by research, or your early postdoc work. So the main sections obviously expected in write-up of a publication in terms of an article, a research paper, are, you probably know this, title, authors and affiliations. When you work in large teams, particularly large interdisciplinary teams, and also in health services research, it would not be unusual that a list of names is a little bit longer than perhaps if you're working in the area of arts, humanities, and social sciences. And many of our co-researchers, co-investigators may work not just in one institution, but may also have multiple affiliations, and you yourself may have more than one affiliation. A paper also begins with an abstract, which we know is a formal summary, very condensed in terms of an overview in a very limited number of words, what the paper contains. And then the main sections of any paper include the background, introduction section, methods, the findings, discussion, the strengths and limitations of the work, which primarily usually focuses on methods to some extent, the conclusions, acknowledgements. And acknowledgements includes those who have contributed to the work, but who do not necessarily fulfill the criteria for authorship on a paper. Disclosures, including funding, and also references. And each journal indicates their specific requirements for these in terms of a very detailed breakdown and you will find that in the specific journal's website. So just to go into a little bit more detail on the abstracts, I'm just breaking these down into different sections. An abstract, a good abstract, is always concise. It stays within the word count expected, and it follows the exact structure requested. So depending where you publish, you may be requested to write up a structured abstract or an unstructured abstract. And here I've just given two examples. The one on top on the right-hand side is an example of a structured abstract where you have very specific guidelines from the journal in terms of how they want the abstract compiled across subheadings. And here below is a paper many years ago that I published for my own PhD, but it was in Qualitative Health Research, which is a more social science-oriented journal, and their requirements was an unstructured abstract, very specific. But the main difference is with a structured abstract, you have subheadings. With an unstructured abstract, you get through the main sections, but without specific subheadings. The key thing is when you're submitting to a journal your work, you have figured this out already in terms of the requirements expected and requested for the journal that you're submitting to. Because if you don't adhere to their rules, it won't get past the managing editor stage. It will just come back to you to make sure you fulfill the journal requirements before it may go out for review. There'll also be a section where you're asked for keywords, and that's relevant. Why you're asked for that is it makes your work more findable through databases. So by choosing very specific search terms or keywords that are very relevant to your work is a very mechanistic way in terms of just making your work more citable, but also findable. And many journals, particularly in health sciences, and particularly sort of medical type health sciences, will request that you use mesh headings for that to increase the possibility of your work being found in databases and subsequently cited. So in the background introduction section, just some key tips. I mean, this would be the case for whatever topic whatever your research project has been, and what you're trying to publish is, so a good background introduction section is, being clear about what is already known about the specific topic in a very concise way. Um, it's an organized, concise, I think accurate account of current evidence, which we often refer to as state of the art. Within the background and introduction, there should also be some indicator to what might be limitations that already exist in the work field to date on the topic, which lends itself to explaining the questions you are asking of your own research and to justify your own study. Before Towards the end of the background and introduction section, the author then moves to giving a very brief explanation why the study presented here is needed. But that can only be done after you've done all the key points above that. And it's towards the end of the background introduction section that you come where you state your aims and objectives at the end of this section. So the research, the aims and objectives around that are never presented at the introduction or background, at the very beginning of the background section, because the reader has to understand what the topic is, has to understand the key issues of the evidence at play, what is the state of the art, and why the justification for this particular study, therefore to lead to presenting the aims and objectives at the end of this section. So that's the logical flow in a good background introduction section. So then moving on to the methods section, I mean, many people here will have said, will have had experience writing already, or certainly reading, reviewing, critically appraising many studies. And they follow all the same format. So in the methods is really an explanation of the overall research design that has to be clear. I think the context of the study has to be stated. This is particularly important in qualitative research, where if you've used qualitative research methods, that's particularly relevant in terms of understanding the context. It has to be clear what the recruitment was, where, when, and how it was done. Of course, we know recruitment is not the same as sampling, so it has to be clear what the sampling procedures were, what they were, but also why. Moving then on to data collection methods, describing those and justifying them, but also you'll also be asked by journals to indicate when this particular data was collected. Tremendous amount of research occurs. More journals come on board. The amount of publications has, rising rapidly in all fields. So publishing is, the activity of publishing has really accelerated in the last 20 years, particularly with online publishing. So you will always be asked by a journal to indicate when your data was collected. Some particular journals will have a stipulation, not all by any means, that they may not be interested in publishing research where the data collected is more than 5 years old. And that one reason for that is to, I suppose, ensure your research is contemporary as possible, because when research is published isn't the same time necessarily of when the data was collected. Then you have to be clear on what form of data analysis you've undertaken. It has to be a very much full breakdown into all the relevant procedures that were part of that analysis. And that goes for both qualitative methods, quantitative methods, and mixed methods. And often we find in a paper towards the end of the method section, or sometimes even towards the end, between the introduction and the method section, you're asked to detail your ethical approvals in terms of what committees and so forth actually proved the study from an ethical point of view. You will not be able to publish original research without getting ethical approval. So then moving on to, after the method section, to the results and findings. I think this goes for all research articles, regardless of the methods. The results section should really answer the questions that you posed at the end of the introduction section. So you go back and you remind the reader that these results are answering questions, the aims, objectives that you set at the end of the introduction background section. The results or findings must be presented consistently with the research approach taken. Okay, so often in quantitative research methods, um, the explanation there, the description of the sample, how many people participated, and so forth, is often found at the beginning of the results section because quantitative researchers will see them as results. In qualitative research, you're more likely to see description of who participated in terms of sampling procedures, participants, and so forth in the methods section, because in pure qualitative methods, we see that is all tools in the methods and in the research process to produce the findings. So whether it's often a requirement of the journal, and reviewers and editors will have, different opinions on that. So often you will follow the recommendations from reviewers and journal editors around that. But nonetheless, the findings presented must be consistent with the research approach taken. As usual, if you're using is all text and display, and that includes your graphs and tables, are they used appropriately to summarize the data? Many journals who have very tight word counts, and you see that a lot in journals that fundamentally just publish perhaps quantitative research or mixed method with heavy orientation to quantitative research, will place a lot of emphasis on really, really accurate tables, very explicit tables and graphs to minimize the word count used in the text to explain the results. So I think that goes for even reporting qualitative research findings, but usually we know in qualitative journals or journals that accept qualitative methods or studies that have used qualitative methods, there is a longer word count given because in most cases your raw data is quotations from focus groups or interviews, and that takes up more word count. I think with any journal, they will, when you go through the very specific requirements of a journal around the use of tables and figures, they will tell you how many max you can use. So usually a cap is set on that for obvious reasons in terms of publication and so forth. I think overall it's important for a good results finding section is that it's clear. It's stated in a clear manner. The academic writing is sharp, it flows, and it's easy understandable. And one important thing is, I suppose for those who might be in the early stages of beginning to acquire skills in writing papers is there is a tendency for at first that you might start discussing your findings in the findings section. Really, the findings section is just a reporting of the actual findings. There should be no discussion of the findings in the findings section because that comes in the following section, which is the discussion. So what is a discussion? And often people will have questions around, well, what's fundamentally the difference between a discussion section and a findings section? I think a nice format to follow this, and many journals will, in the health sciences particularly, and many palliative care journals will kind of take this approach, is at the beginning of the discussion section, there's probably a very, very quick summary of key findings that you summarize that have been presented in a long format in the findings section of the paper. But you do this very, very briefly because the knack here is not to fall into the possibility where you are actually repeating your findings in the discussion. And that's really sort of a learning process. It involves multiple iterations, obviously, when we write papers to get them right. But really, the discussion is fundamentally about how do the findings from this current study that you have compare with the previous published literature. Obviously, if you're doing a PhD, you're very invested in the existing literature. In an introduction, in a literature review chapter of a thesis, they're quite long, So it's taking the key nuggets from that and then writing them in a very, very confined space in a paper is another skill. But there has to be some sort of referencing in relation to how the findings from your study are situated within, compare, add to, or ask more questions of what we need to do. Then one has to ask themselves, what are the implications of the findings? And depending on the journal requirements, you may be asked to situate these paragraphs, or even sometimes with subheadings in themselves, in the overall discussion section. And very important in our field, and particularly in healthcare, health sciences, health services research, patient-oriented research, and so forth, is what are the recommendations from your research for future research, but based only on the findings of the study that you have, okay? And also what might be some recommendations for practice, particularly in palliative care. Palliative care is delivered in practice. So there is a significant practice dimension to showing that the implications of your research have impact or potentially have impact for practice. Because in palliative care, that's what we do research, is to figure out how best to provide interventions, what services work best, and so forth. So it's not uncommon, particularly in more practice-based palliative care journals, or healthcare journals or health science journals that you might be intending to publish your work in, is you will be asked specifically to do this, and I would say really high quality journals will be very, very specific about what their expectations there are, so that they give as much structure and advice to the researcher who are beginning to target their journal or thinking of compiling a paper that would suit that journal. And then the strengths and limitations are always so important. You need to critically evaluate the study in terms of its methodological rigor. It's a key learning part of, I think, postgraduate research, is we know the results or findings of any study are only as good as the methods used. And if the methods are not appropriate or not incorrectly or are not fully or properly executed, that has limitations in terms of making sort of even recommendations for research and practice, but also having potential impact. So it's really important for the methods that the methods match what you're trying to do in your project, and that you understand properly the methods that you have used. Because if you don't fully understand the methods, it's very hard to really critically evaluate the methods in terms of the strengths and limitations. And every study has strengths and limitations. In light of the above, is what you now claim about the results or findings, can you justify that? And really good quality journals, peer reviewers are top of their field. They may be methodologists, very strong methodologists in your field of research as well. Will pick up on some potential weaknesses. That may not that doesn't necessarily mean that your research won't get published, but it's more so about, does the section on your strengths and limitations, is it accurate? Are you being realistic about the strengths and limitations? As I said, all studies have strengths and limitations. The task here in terms of, I suppose, critically appraising the work is to state them clearly and correctly. And you will often be asked for strengths and limitations. People sometimes can be a little bit apprehensive about that, not to overdo the limitations. Will that reduce the possibility of your research being published? I think if any paper comes back with major revisions, it means the journal is interested in it, and it's up to the researcher to follow the guidelines and recommendations based on the reviewers and or editors. So then the end of a paper is always the conclusion section of the paper, and what are the relevant concluding points? Whilst the conclusion section might be shorter than a results discussion section, it takes much longer to compile, because there are points that are concluded simply based on the findings that you have presented and discussed before you get to the conclusion section. I think any good conclusion section needs to be scientifically deducible from the results available in the paper presented, not in other papers. So the conclusion is based on the findings presented in your paper. And they should not be exaggerated or out of scope in terms of how much leverage there may be in the findings. And that comes back to, I suppose, understanding the strengths and limitations of the methods you have used to produce the findings in the first place. And then references, obviously, at the end. These are the painstaking, time-consuming things to do, but for publishing in quality journals, they have to be exact. There are many programs that help researchers do that more quickly than before, such as EndNote and so forth. But the reality of it is every journal can have different requirements for referencing. APA, Vancouver, BMJ, which all have slight differences. And even in publication systems, publication referencing systems that are numbered, such as Vancouver and BMJ, they are different in themselves. So again, often the time it often takes to get your reference list correct and make sure your reference list is absolutely 100% consistent with the in-text referencing can be it's longer than you expect, particularly doing complicated systematic reviews where you're dealing with many, many references, and particularly when it's numbered and things change. But good journals will pick up on this, and good journals this will be picked up even at a copy editing stage when one gets proofs to review the paper before publication, and that can sometimes involve more work if you haven't got that right from the very beginning, even if your paper has been accepted before you see it in proof stage. So authorship, just wanted to talk a little bit about authorship. And what that is, and I suppose the game around authorship in academia, which can be good, bad, and different. Authorship is obviously very important for a research career in the health sciences. First and last count quite a lot, but in other fields, though that criteria don't necessarily apply. So I think it's important to be aware of the type of research you're doing, what your research is about, and how are you going to be as a researcher assessed in terms of your own publication record. So if one works in health sciences, we typically take a first and last, but not always, but we do generally for original studies and systematic reviews. The first author is often obviously a PhD student if their supervisor is the last, or a PI of a larger project that is perhaps funding the PhD project will be the last author. And you may have many or multiple co-authors in between who are all providing a valuable contribution to the paper. So fundamentally, we go by the Vancouver recommendations in terms of what an author is and who isn't an author. And they have three main criteria, and that is if a person has contributed substantially to the conception or design of the work, or the acquisition, analysis, or interpretation of the data for the work. So it's or there, and drafted the work or revised it critically for important intellectual content, and made it a final approval of the version to be published, but also agreed to be accountable for all aspects of the work in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. So they are the three main principles, I suppose, criteria within the Vancouver recommendations for authorship. And in our fields, is what we sort of fundamentally stand by or work towards. Just moving on then, because we is talk a little bit about, at the beginning of the presentation, when you're deciding what type of journal to target. And we're here talking as palliative care researchers or undertaking studies in palliative care field. And, are you going to choose a palliative medicine or a palliative care specific journal or not? There's an increasing choice and scope of more journals. Publishing is a billion-dollar industry, including publishing in healthcare research. And I think from an academic career, in terms of your CV, it's always good to publish in a mix of journals. So mix of very specific fields or disciplines outside of your disciplines, but where your findings are very applicable. And also in methods journals, in terms of methodologies involved. So often we learn a lot from our methodologies by doing original research. And people who are interested in methodologies or certain types of methodologies will also publish methodology papers illustrating with examples of the research they have done, their original research that is, in terms of how doing research is actually contributes to the evolution of a particular method. I've just given some examples here of some of the very many palliative care journals, specific journals out there globally. But again, we often publish in non-specific palliative care journals. So in many ways, it can also widen readership. So as I said, it's probably good to have a mix. I just all palliative care journals, but also these are palliative medicine and palliative care journals that are interdisciplinary, so they're not any specific discipline. And we know research now is really interdisciplinary based. And I think palliative care research, palliative medicine research, or any research concerning delivery of palliative care services is fundamentally an interdisciplinary sort of initiative. Um, so you think about scope, you think about the word count, the specifics of the content. These are always detailed explicitly in the web pages, the website of a journal. You think about your age of your data. If your study has, if the data for your study has been collected, not when your study finished or when you finished the PhD, it's when the period of data collection. As I said, some journals can be quite picky around capping a time between that and the time you submit a paper. So often people, when you're doing your PhD, you might think, well, I finished my project stopped when I finished my PhD. But actually it's around the data collection period, because often a data collection period can be in the early to mid stage, often is in the early to mid stage of a PhD. And there are 2 years after that before maybe are doing, writing up your PhD in full or being examined for your PhD. I think you always have to think about the potential impact of publishing. So everything is about impact, and not just impact factor of a journal, but impact in general. What do you hope will change, or how might services improve, or how will knowledge evolve, or because of what you did in your research project? So I think you need to think about, when you think about impact, it isn't just about the impact factor of a journal. It's about what reach do you seek and why. Yes, the importance of the impact factor. I do look at impact factor of a journal, but we're not in maths. We're not in hard sciences where impact factors are going to be very, very high. So our journals will be a little bit lower in terms of impact factor compared to other areas. But impact is a lot of things beyond the impact factor of a journal. I think when you can generate some impact from your research, it establishes and increases your research profile. And if you're interested in a research career post PhD, that's really important because it's quite competitive in terms of securing research grants and also securing academic positions in a university if that's the direction you're going. It also fuels ongoing research and a profile that is needed to gain funding. So applications for funding, yes, they're very competitive, novel, new. A lot of work goes behind applications, but also some weight of an application is weighted towards the reputation and previous achievements of your research, so that there is a trajectory there that's obvious. And also we have to think about in palliative care, about the evidence we produce and how it relates to policy practice and research. So I've talked a lot about, implications for research and implications for practice, but also there's implications for policy. Because at the end of the day, in terms of who decides how health services are provided, funding, structure, and so forth, is policymakers, government, and so forth, who rely to some extent only on evidence, but not all. So really in our fields, it's also about engaging with key stakeholders, key policymakers in terms of moving the findings of your research forward to have potential impact. Because only when you think about it in academia, a very select number of people only read research journal articles. It's people who work in the field, who are doing research, working in academia, and of course the issue that this isn't available to everybody. I know open access is increasing, but we're not yet, worldwide, haven't reached a point with any publisher where everything is open access without a fee. Just want to say a little bit more because I have a couple of minutes around PhD-based publication, because it will depend on your PhD program that you're on. Whether you're going to be assessed by a traditional thesis format or whether it's a PhD by publication. So different universities, different schools within universities may have different systems. But if your assessment is via thesis, which is still the majority of the cases in Ireland, you also need to publish papers in tandem and use within for a thesis. So it is fundamentally the same work, it's just presented in a slightly different way in terms of chapters and so forth. But it really, really, I can't emphasize how important it is to anybody doing a PhD, whether they're full-time, part-time, to publish papers as you go along in your PhD. It makes the final write-up of a thesis so much more achievable within the time frame that you have. So there's great learning in the process of publishing as you go. And I think if there's any key message from here today is publish as you go. It will make a difference in terms of your research career. Um, just to speak a little bit about open access there, I mentioned it briefly a few minutes ago. Some of you may be familiar with the big changes in that sort of field in the last 5 years. We have an IREL agreement with academic publishers, which encompasses our main universities in Ireland. I won't get into too much detail about that, but basically it has resulted in more research being published open access without the author having to pay the actual fee for that. Okay, so I've just given you the link there for the IRL open access, which explains that more detail and explains what publishers are involved in that agreement and how much they give within that agreement, because there are limitations amongst other publishers. Most of you probably know about your research identity in terms of you haven't an ORCID number yet, get one. And that basically is your identifier, unique identifier as a researcher. It avoids the possibility of, if you have the same name as another researcher, of being oversighted or undercited incorrectly. And when you're publishing, particularly in health science journals, you are asked, certainly as first author, to provide an ORCID ID. So I would recommend that every person who is doing a research project, even if you haven't yet published, you can develop make an ID ORCID. That links, of course, your researcher ID and to your Scopus and to your Web of Science, and also to Google Scholar. I think also this is just ongoing publications and citations can capture a researcher's trajectory. So again, if you're orientating towards a research career in a university type employment, it is all about trajectory in research, particularly if you're seeking to work in a university that is primarily research driven and research dependent in terms of functioning. So this is just an example here of Google Scholar and here on the right hand side of Scopus in terms of tracking people's publications and citations over time. And just as kind of towards the end, just to mention a little bit about career progression as a researcher. They mean different things in different situations in different employment structures. So when we take the academic setting, like a university, into consideration, your research and publication activity, where does that lie? So I think this is a nice triangle in terms of, early career researchers or PhD postdoc. Mid-career, usually, not always, funders can define this differently. It might be a senior research fellow, assistant professor, associate professor, and very established people who have a long established career in research activity in a university may have reached professor in or professor of, which is a chair position. But if we look beyond the university setting, not every person who does a PhD will want to work or is aiming to work in university, because we can use our research skills to work in different settings as a researcher, informing systems and so forth. So many people who choose not to gear towards trying to get employment in an academic position will go towards research-led organizations. It might be in the statutory, voluntary, private sector. They may move into research leads, research program managers, and lead and manage research programs. And many people go into the health services development, Department of Health, HICWA, and so forth, because they have the skills as a researcher to sort of advance services there and systems. And that's it. I think we're up to 45 minutes. Thank you very much.